Western Spring Television. Ours it is.
Yes, good afternoon, listeners at home. You're welcome to the maiden edition of our dear program, Spring Clinic. In this program, we will have the privilege of knowing all that is about consultation, what it takes from the moment somebody has a complaint, and then the intelligent process of seeking help, investigations, how to go about, which hospital to go, which kind of doctor to see, the kind of medications that are prescribed, how to adhere to instructions. When there are complications or there are problems, what are we supposed to do? And then, of course, when we are thinking of changing our doctor, we're thinking of changing our hospital, what can we do? And then, of course, we're going to be learning from here a lot of things that have to do with the process of consultation. That is going to see the doctor and interacting with medical personnel. This program is also designed for people who have specific problems, because we're going to have ranges of topics that deals with the total person. Different specialties are going to be discussed here, dealing with different aspects of our health. So most of the problems most of us have, questions, things that bother our minds that we feel, oh, I want to ask my doctor this question and I didn't have enough time, or he didn't have enough time. This program is going to provide a platform for us to answer those questions. And this is the maiden edition today. We will be talking about intelligent medical consultation here today. I have the privilege of having Dr. Ogungbemi Ayodeji Oluwaseun, a consultant family physician with Uniosun Teaching Hospital, and also a lecturer at University Uniosun too, at the Department of Family Medicine. Dr. Ogungbemi, you're welcome, sir.
Thank you very much, sir.
It's a privilege to have you on this program. And I hope we're going to have a very wonderful time discussing this afternoon.
Yes, we will. It's an honor for me to be here with you, sir.
Yes, because for your field, it's very pertinent that people, you are quite close to the community, you are quite close to the people.
Yes, sir.
Especially because when you have family medicine, it means you deal with the family.
Yes.
While some of us in other specialties are highfalutin there. You have the privilege of being the first contact,
yes, sir,
when people have problems in the teaching hospital.
Yes, sir.
And you know, people are always afraid of the teaching hospital.
The teaching hospital, yes.
You know, so it's a privilege having you here, and I specifically requested that you should come on board for this maiden edition, because intelligent medical consultation is not possible without a family physician.
Very correct.
Yeah, you're welcome, sir.
Thank you very much.
Yes.
It's an honor for me to be here.
Yeah.
Thank you for inviting me.
Yeah. I know that by the time we go into the discussion, people are going to benefit from your wealth of experience, your experience as a family physician, how you have had to be involved with families, because we only see a patient oftentimes, but the family, the patient comes from a family.
Comes from, yes.
Yes, so oftentimes that makes for intelligent consultation, because a lot of times even people who are giving the care maybe even have more troubles than the patient themselves. And when the person who is taking care of the patient himself is sick, all the instructions they are giving to the patient. No, that's how crucial your department is, your unit, your specialty.
Yes, you're very correct.
You know, when we get into specialties, we lose touch with the family at times. We look at patients as cases. And then gradually we begin to see them more as entities,
yes,
clinical entities,
yes,
rather than people coming from a tribe,
yes,
coming from a family,
yes,
coming from a religion,
yes,
coming from different kinds of psychodynamics, yes, that specialties don't emphasize.
Sir, you're talking like a family physician.
No, because I have you around. No, because this is very important because a lot of things that has to do with compliance, that has to do with obeying what the doctors have said, has to do with your field.
Very correct.
So maybe you should tell us a little bit about how important this your field is with intelligent medical consulting.
Thank you very much for the privilege to be here at this meeting edition. And you have actually said a lot, but I need to maybe bring out some points so that people outside there will have a proper understanding of what this specialty is all about. Just as you have mentioned earlier, when this specialty was going to come on board, because it's not a very old specialty as it were. When it was going to come on board, I think the trend had been, there was a time it was the generalists. Everybody, once you graduate from medical school, you're a doctor, and then a time came, we needed the specialists, and then the specialists came on board. We had the nephrologist, we had the orthopedic surgeon, we had the general surgeon, we had the nephrologist, we had the endocrinologist,
we had the psychiatrist,
and so many. Yes. And then, there was a burden. The burden was this, and a lot of people don't have one condition. A lot of people have comorbidities. They have diabetes and they have osteoarthritis. So they have maybe a high problem also. So they have to see an ophthalmologist on Monday, had to see an orthopedic surgeon on Wednesday, had to see an endocrinologist on Friday. So a lot of things, time was being lost, a lot of money was being lost. Even employers of labor started to complain. So, and then there was also the dimension of treating the disease condition, as you mentioned earlier, sir. A lot of specialties treat the disease condition, and then they leave other aspects of it. And what are the other aspects of it? We have spirituality. Everybody has a form of spirituality. The psychosocial aspect, the family aspect, because if I dwell on the family aspect alone, we may not even live here today. So all this brought about a need for a specialist, leaving the generalist now, a specialist, let me use the word generalist, such that can handle issues until a point where we would need the specialist. So that brought about the concept of family medicine. So I have to treat a person, either male or female, irrespective of gender, irrespective of age, then irrespective of disease condition, from cradle to grave, in the context of the person's family and society. So we don't treat a person as a disease condition. We treat the person in the context of the family and the society. So my treatment pattern, though with the same disease condition, would differ because the family dynamics of each person differs. And maybe I should quickly bring about one or two examples to bring out this point. There was a time one of our doctors attended to a particular lady that kept complaining of low back pain. You know, so a low back pain, after due consultation with us, we found out that the reason, a female now, for the low back pain was not that there was any disease entity as it were, but it was psychological. The woman had a family problem, a dysfunctional family. The husband had issues with her, and then she started having somatic symptoms.
And so it came as low back pain.
It came as low back pain.
I can see that Dr. Ogumbe is loaded for us this afternoon. We'll have to go on a short break. When we come back, we're going to delve into the meat of the discussion today. Intelligent medical consultation. Don't go away. Thanks. Yes, you're welcome to the program again. I would like to ask Dr. Maybe, what can you advise as a mode of referral, or where a patient should go, or what determines where a patient should go at the point at which I start having some complaints? Yeah, I'm asking this as a layman. Most people, a good number of persons are scared of the teaching hospital. A lot of protocols. And I've seen people go through a lot of pain. This person has acute abdominal pain. He has serious pain. We just did the injection to please calm this person. I don't want investigation. I don't want one doctor, gray hair, another small doctor asking, when was your mother born? When was your father born? Is he dead? Is he not alive? Some people feel, don't go to that place. Just go to one place near our house there. The man will quickly give you some things to do. Please, what determines where to take a person to when there's a complaint?
Thank you very much, sir. That's a big question. And I'm actually wondering, should I answer it in Nigerian context or in the ideal context?
I think in Nigerian context, okay, so that people can be helped.
Okay. Then I'll start from this point. Maybe I'll talk a little about the ideal so that we can now delve into the Nigerian context. Ideally, we have 3 tiers, 3 levels of healthcare. We have the primary, we have the secondary, we have the tertiary. And the primary should be the nearest to anybody. So any minor complaint or even the first complaint should actually be handled at the primary level.
If it is not serious?
If it's not that serious. Even if it's serious, the person goes there, then it is properly diagnosed, and then the person is referred to a secondary level. So in the ideal setting,
there should be a doctor at the primary care level?
There should be a doctor at the primary care level. That's at the comprehensive health center.
Okay.
At the comprehensive, every community should have a comprehensive health center where a doctor is present.
Oh, yeah.
And then the doctor identifies or makes a diagnosis, and they know that I can't deal with this. Go to the secondary level. The secondary level will, if they can't sort it out, most times secondary level should sort out most of the cases. And then maybe the very bad ones or the complicated ones or the rare ones goes to the teaching hospital.
Okay.
And that's the ideal.
Yeah.
But coming to the Nigerian context.
Yeah.
So the family physician should be either the comprehensive health level or the secondary healthcare level,
okay,
and the first contact at the tertiary.
Why is that important?
It is important because a family physician is trained, having a specialist, generalist training, and having putting into context other dynamics. One could identify, is this a problem that needs medication? Is it a problem that just needs minor psychotherapy? Because major psychotherapy, the psychiatrist should have that done.
Yes.
So minor psychotherapy, some complaints could just be reassurance, and the person goes back without medication.
I think at times it is also to also ensure that specialists don't overdiagnose.
Yes.
There's virtually no complaint anybody brings to me now that is not psychiatrist. That is not psychological.
You are very correct, sir.
Somebody told me, is that I'm always making diagnoses. Even if you are coughing too much,
yes,
I can come up with some form of...
A specialist will see something associated with that cough.
And before you know it, there's a diversion from the primary problem.
From the primary problem.
I think I'm
that's yes.
Okay, so that's the role of the generalist in our teaching hospital,
yes,
in our secondary care level,
yes,
even at the primary, at the comprehensive healthcare level.
Because one of the roles of a family physician is to coordinate care. That is not necessarily that the family physician does the treatment, as it were.
I get your point.
But I can identify
like a manager.
Like a man, yes. In fact,
management of care.
Of care. And okay, I don't need to apply anything here. Somebody else should see. I could even, sometimes our management could be assigning public health specialists or community extension workers.
I get your point.
Follow this person down to his or her house and address this issue. The issue could just be sanitation issues.
Oh, yeah? Something that is causing
something that is causing the problem. Once
Yes.
that is sorted out, the person does not come to the clinic.
So,
maybe for
in
checkup.
Nigeria now, how do we, like in Oshogbo here, how do I
Wow.
go about this?
The challenge with Oshogbo here, not just Oshogbo, Nigeria as a whole, is that the primary healthcare level has been wiped off. We have the structures, but we don't have the people. So it's a mess. What was introduced was actually a fantastic idea, fantastic pattern, but presently it's a mess. And the brain drain is really, contributing to
so
that.
you actually will find a doctor in the primary healthcare?
I don't think we would find a doctor in the primary.
Because I once had a cousin who was pregnant and was going to one primary healthcare, and I said she has had a cesarean session done before. And I said that's not the place to go.
Yes, it can't be there.
Until I told her to go to Ashubiaro.
Yes, it can't be at the primary. Yes, at secondary, and sometimes secondary may assess it and find that they need a tertiary care. So that's but what we have now is that people, even the secondary has problem. That short staff.
Okay, they are short staff. The doctors are overworked.
The doctors are in fact, if I delve into that, it's going to be a major issue because of the massive brain drain now. And brain drain is not just about doctors. It's about doctors, nurses, just mention it, physiotherapists,
yes, anesthetists,
everybody's living. So, and we also have issues around leadership. I may have to face the truth.
Leadership in terms of what?
Leadership in terms of governance.
Okay.
Prioritizing.
Okay.
A lot of people don't prioritize healthcare. Because once a man can eat, once a man can go to the toilets, a lot of people assume that they are well.
But you doctors keep talking about prioritization. What do you mean by this priority?
Prioritization is about allocating the necessary resources into the healthcare sector.
How can it be? Okay, now, assuming the governor is listening to us here, and he wants to do something unique, despite the drain, what can we do so that our people receive adequate help? You know, my question was my discussion is intelligent medical consultation, meaning that with the scarce resources, how do we navigate through the point that the patient is coming with a complaint and having adequate care for that problem? What can you in the context of our situation here now, because I think they can go to the teaching hospital, or to the general hospitals?
They can go to general hospital.
Okay.
Well, we talked about the ideal. So, but what we have now is that a lot of people go to the general hospital.
Go to the general hospital.
They go to general hospitals.
Okay.
And then also a lot will come to the teaching hospitals, first-hand teaching
How about the private hospitals?
And then a lot goes into the private hospital. But the private hospitals are having problems now because the brain drain is affecting all sectors, all departments of the healthcare system. So the primary hospitals are there. They have to complement. I regard the private sector, the private hospital, as a complementary arm of the healthcare sector, because the government hospital cannot single-handedly handle.
That's the reality.
Yes, they just cannot. For example, the entire Osun State, we have just 2 teaching hospitals. It cannot suffice. What's the capacity?
But we have a lot of general hospitals. Yes,
we have a lot of general hospitals.
Yes,
I'm actually coming to that. So, for anyone in leadership now to address that issue, there needs to be a real roundtable discussion with stakeholders, because we're already in a messy state.
Yeah.
And there must be sincerity of purpose.
Yeah.
To address it.
You mean they need to empower the the general hospitals? Or
wow.
Because if the general hospitals don't have enough, we can't be posting doctors to the primary healthcare level.
Yes, the general hospital, it's not, we can't empower one and leave the other.
But we have scarce resources now.
Yes, sir, we have scarce resources, but there's a way we rationalize.
That's true.
There's a way we rationalize. The primary healthcare, the primary level cannot be disenfranchised. It cannot, because
maybe we should just
it's the closest.
We should
to the
put
people.
some experienced nurses and experienced healthcare workers there.
Yes, at the primary level, the primary healthcare level has 3 levels.
Okay.
The topmost is the comprehensive.
Okay.
The health post is the first. The health post, we have the community extension workers and maybe a nurse that handles that. Bites, bruises, minor lacerations, vaccination exercises. They don't need a doctor to handle that.
Okay, but the comprehensive.
But at the comprehensive healthcare level,
should be a doctor.
There should be a doctor or two, must be there, must be present, and they can be encouraged, Because a lot of people don't want to stay there because the comprehensive health centers are located outside of town.
Absolutely.
So a lot of doctors don't want to stay there.
Because the tendency is that first of all, wearing our jacket now, we've been talking about Osogbo, Ife, Anede. Meanwhile, a lot of our people are in the villages dying of things that shouldn't kill them.
Yes.
Yeah, I get your point now. So the comprehensive health centers should be some form of priority.
Yes.
So if we have a doctor in every comprehensive health center, it's going to really help.
It's going to really
the
help.
referral system.
Exactly.
Coupled with a good ambulance
system. Yes, sir.
Yeah.
So a lot of cases will not even come to the teaching hospital or even the secondary, things like malaria, typhoid enteritis, things like that should not come up, except for the complicated ones.
I get you.
So it's a major issue, but we don't have doctors there. We don't have doctors, and it's a Nigerian problem.
Maybe they need to. How can they get doctors to work in comprehensive health centers?
Sir, as I said, there must be a stakeholders meeting.
Okay.
Because over time, we have issues around sincerity of purpose. So the health...
Even the health administrators who are doctors too, doctors are quite strong in some of these policies. Or what's the handicap in your own opinion? Because they're not bringing carpenters to talk about how do we allocate our scarce resources and then get
I think
some of these resources.
it's not going to be a one-man show.
Okay.
If it's not going to be a one-man show, it will go a long way.
Okay, so we are
a group of people to be brought on board.
To be brought on board and then talk to government.
And then talk to government.
So
and
that
government
we
should
don't...
be willing, because without political will, there's nothing.
No, because at times, you know, you people in the teaching hospitals want to buy CT scan or some form of MRI that is costing several billions of naira. Meanwhile, the comprehensive center is left unattended.
Yes, and that's why in every state we have just one, or let me talk about state now. We have just one state teaching hospital.
Teaching hospital, okay.
So that it's just one for the rare cases, for the complicated cases.
Okay.
But we have several comprehensive centers.
Okay.
We have many secondary healthcare general hospitals. Then just one, or maybe maximum two for some places.
So from the point you are making, I can get it, the head post, the primary health center, then the comprehensive health center, then the general hospital.
General hospital.
So that the people in the villages are also not left out of that that chain.
Yes, in fact, before coming here, I was at a scientific conference.
Okay.
The ARD was having a scientific conference, and the Oba that was brought there made a complaint and mentioned in his remarks that there is no hospital, functional hospital.
But there may be some structures are there.
The buildings are always there.
They're always there, yeah.
In fact, there was a time I was asked to coordinate a program at the primary care level to supervise a program. And a venue was chosen, and it appears to be a well-built structure, has a generator, has a theater, good ward, but no doctor.
Now, can we do task shifting? But there's a limit to which, because
there's a limit.
But I feel in those rural areas with comprehensive center, can we do some form of task shifting? Like these community health officers?
Yes.
Or nurses? I mean, in that, I'm not too familiar with
that. That is taking up the roles of...
Taking up, yes. Because when I was young, I remember one of my daddy's friends was a dispenser. I don't know whether you ever grew to meet them.
I do not.
They were trained to handle problems like cuts, treat malaria. Some of them can inject. They used to call them dispenser. Do you know, in the small towns?
Sir, but the challenge with that, I agree, because there are some African countries that have done that.
Yeah.
In fact, some African countries have trained some people to do some minor procedures, minor surgical procedures.
Yeah.
But in a place like Nigeria, even the person that is not... Sir, community health extension workers, some of them, not all of them, parade themselves as medical doctors.
Because that's the role they are somehow playing in the village. So maybe it's possible
and it deceives the public.
I think we may need to also find a way to collaborate with them rather than trying to demonize them.
No, we are not.
What I'm saying
their role is important.
I know. Would there be a way the government can actually find a synergy with these other people?
That's one of the reasons why I said that elders in the health sector, I didn't say among the doctors, will have to...
The government will need,
to sit down, and I don't believe we should follow the narrative from other countries. I believe we can always determine our narrative. How do we want our health sector to look like? These are our problems. We don't necessarily have to follow the European system. We don't necessarily follow the U.S. system.
Let's
because our
let's
problems are
adapt
problems.
it to,
Adapt it to our situation.
Because
there.
you know, my question was this: from the point somebody has a complaint, how can somebody get adequate help? Because let me put it to you too that with the absence of our comprehensive health centers, so-called private practice has flourished.
Yes, sir.
And a lot of quacks are there.
Yes.
How can we get rid of this? Because some people don't have to die if they can just get to appropriate places, appropriate referral to somebody that can offer help at the point.
Nobody deserves to die. And
because you see, if you hear what kills some people, it's just a lot of things that are preventable. Preventable deaths, yes.
Malaria, simple malaria.
Unless somebody in the village comes and then is begin to count about 8 or 9 drugs together to see whether 2 or 3 of them will work.
Sir,
you know,
with my little years in the field, I still think that the government must be sincere in addressing these issues.
Are you saying that the doctor in comprehensive health center must be paid more than the one in Oshogbo?
No, not necessarily.
But then maybe there could be some allowances.
Yes,
to attract a doctor.
There should be allowances
some form of
to attract a doctor to stay at those places. That's one. Number 2 is that we should be. I thought about this, sir. Is it possible that if I am from Obokun local government,
okay,
and I am working under the state government,
yep,
why can't I be posted to Obokun local government?
Okay, if you're from here.
If I'm from there, yes. And people know my father's house.
Okay.
They know my house. So if I misbehave, they know who to call on.
Absolutely. But not all local governments may actually have doctors that are around. A good number have traveled out. I think we just need to learn to solve these problems. I think for people to stay in the comprehensive centers, if they have some form of allowance,
yes,
that is different from those of us in Oshogbo.
Yeah, there should be something.
As inducement.
There's something we call rural allowance.
Oh, rural allowance.
Yes,
yeah.
there's something like that. So, but it also depends on what the places the government considers as a rural center. And I'm aware that Oshogbo Ife used to be called maybe the urban.
This urban.
And I'm also aware that some years back there had been a restructuring of a place where we call rural or not. So that's affected that rural allowance. But we must just have to put the fact on the table and address it.
And then address in the context.
In the context of our own
the available human expertise.
Yes, sir.
And then the resources that are available. Because it's unfair when you hear what kills somebody. This is not something that we can prevent.
Particularly the children.
The children, especially.
The children die.
But how about, let me ask you about the private practice too. Even some doctors, a good number of course, specialists at times wants to attack you, generalists. That at times in the context of trying to practice your family medicine in private practice, you guys have a tendency of holding on to your patient that is supposed to have been referred to specialists. What do you have to say about
anyone that does that? Well, I can't speak generally, saying that I can't exclude, because amongst a group of people there will always be others that are not following the ethics. The teaching and the training is that once you identify a need that you are not equipped for, you either call in a specialist to address the person at your private hospital, or you refer to the appropriate center, either a specialist hospital or a teaching hospital. Because it could also be another private hospital, because private hospitals are also in cadres, they're in levels. There are general private hospitals and there are specialist private hospitals. Okay. So that's the training, and that's what should be.
Thank you, Dr. Ogungbemi. It's been wonderful discussing intelligent medical consultation with Dr. Ogungbemi here. We'll go on a short break and then we'll come for the roundup. Thanks.
Turn it up! It's the Wild Wild West. And Western Spring Television is pulling out all the stops to make sure that you don't miss out on every of the fun and happenings around you. Yup, we've got you covered because your girls got all the juiciest tidbits and entertainment news from around the world. Cross over to the chocolatey side of entertainment. Join me, Chocolate Cassie, on Eccentric as we take you into every bit of the juiciest news, fashion, music, movie updates, and other trending conversations. Together on the show, we'll get personal with your favorite celebrities via phone call, Zoom, or even live here in the studio. Eccentric will be shown on your TV screen on Western Spring Television, channel 190, only on StarTimes.
Yes, you're welcome to the last segment of our discussion today. I'm having Dr. Ogungbemi Oluwaseun Ayodeji, a consultant family physician with Union Teaching Hospital. He's been discussing what makes an intelligent consultation and, of course, facing the reality of brain drain and, of course, poor health infrastructures. We're going to round up, and I'm going to put this to him. Having told us about all these problems and then, of course, the kind of predicament that we are in, how do I know that I'm in the right place? The primary posts are not as functional. The comprehensive centers don't have a doctor, so most people say don't go there. There's one hospital down the road. How do I know that I'm not with a quack? How do I know when I need to exit my patient? Why the person will say, don't worry, let's look at the patient for some time. Wait, by tomorrow you will see recovery. I mean, a friend of mine just called me from Lagos that in Ilorin Ogun, his father-in-law had a problem and they just assessed and the man said he was going to operate. By the time we brought the man here, he didn't need operation. So how do I know that I'm not pushing my wife, my son, my relative into a place where they will kill them?
Well, so you have asked a very beautiful question, yet a very difficult question.
Yeah.
Because I also, this discussion has been on. I'm a member of different committees and has been on for quite a while. How will a patient know
The patient
or
relative.
identify
Yes.
the proper hospital, the
Yes.
ideal hospital,
Yes.
a registered hospital? Because even the registration has issues now. Because not all hospitals are manned
properly.
by a doctor, but they have registration. And it's unfortunate to say that there's no way, as of now, that the masses will be able to identify.
But they can try.
Yes,
They can ask for a doctor. Who is the doctor here?
yes. I'm bringing all
Or
that.
who is the head?
I'm making this statement because this is a TV program,
Yeah.
and I'm hitting the nail by the head.
Oh, yes, please.
Our people don't know how. Because many of the things that need to be in place are not in place. The Ministry of Health should have a directory. Should have a directory of accredited
Hospitals.
hospitals and with their associated level of care.
I get
So
the point.
I know that with a case like this, it shouldn't be this hospital. With the address and contact details. When I used to grow up, we used to have NITEL. And NITEL had this
Directory.
directory.
That's correct.
From anywhere
Yes.
At any time, I can always open the directory.
And then call.
Okay, this is my area, Akpata,
Yes.
Ibadan. Okay, I'm looking for a social street. We should have something like that should be readily available, both hard copy and soft copy, that anyone, anywhere can open the directory.
It's
And say,
fantastic.
okay, I'm looking for, because I could be a new person. I could be driving by,
Right, yeah.
and there's a medical emergency that has occurred on the road or in the vehicle. May not be an accident.
Yeah.
I should be able to access, say, okay,
Directory
which
of this
hospital? Okay,
area.
this is the street I am on.
Yes.
What hospital is close by?
Registered.
Is it a registered hospital, accredited hospital? Is it a primary care hospital, secondary care hospital, tertiary hospital? I should be able to have that. I should be able to access it. And this is the responsibility of the Ministry of Health.
I get your point.
So what we have now is that a lot of people open centers because they don't have a way of identifying.
So a lot of quackery.
Quacks, the quackery is not only in the personnel. We also have it in the structure, but and it's together. It's such that a lot of quacks have capital, they have resources, so they have good facility, but the expertise is not there. It's zero.
There.
And sometimes,
So maybe people can ask question. Are you a doctor or a nurse?
sir,
What can you do for us to help us?
Earlier,
Such questions.
I mentioned that the term doctor or asking a person if he's a doctor or not may not work.
May not work.
It only work for whoever is impersonating or using that title that is timid. Because a lot of people parade themselves as medical doctors. I'm not in any way downgrading other members of the healthcare sector, because everybody is needed. I need even to be cleaner. I need a cleaner in the hospital.
Yes.
They have their work. Without them, I cannot have an aseptic procedure.
Absolutely, yes.
So I need a nurse, because without adequate nursing care, whatever I do will fail. And every other, I need a physiotherapist. I need a laboratory person.
Yes, that will help.
Because
me
there are sometimes, yes,
we are confused. We are using a particular drug, is not working.
Yes, and it's meant to be a teamwork. So
Absolutely.
everybody in the team is very important. But what we have in our system is that maybe it's a societal problem, that everybody wants to associate with the doctor. And
But there's also this tendency of the family doctor.
yes.
And the man treats everything. And your parents will not allow you to go to any other doctor.
Yeah. So I need to bring that in. Everyone should have a family doctor. Everyone should be. Either you have it at the government level or private level. And what the role of the family doctor is just like a family physician, knows you, knows your medical condition,
knows the family,
knows the dynamics in the family, knows the predisposing or regular or frequent health challenges.
Yes.
So if anything comes up, he picks the call, you have an access to him or her, he can dash down. There's the concept of home care. But it is not in the office of the family doctor to treat all cases.
Absolutely.
The family doctor should know when to refer and the good center to refer to.
Thank you so much, Dr. Baby. I can see that you are loaded with a lot of information. 1 hour seems not to be enough for this program. I'm sure our viewers at home have benefited from your wealth of experience. I didn't know you are this vast in all this. You are attending, apart from the clinic practice, you are also involved in a lot of policy formulations,
Yes.
that could benefit our people. Our viewers at home, thanks for staying with us. We still expect you to come this same time next week, by God's grace. Thank you, and have a wonderful afternoon.
Healers Olayinka Herbert Macaulay, politician, national